You could go.
Hello and good afternoon, and welcome to Dateline New Haven on WNHH-FM. I'm your host, Paul Bass, inviting you to look behind the headlines, the stories that make our community tick. Dr. Dalal, our guest today, makes New Haven tick in a big way, but you might not all know that. He's a man these days who's busy making history instead of making headlines. Let me tell you what I mean. Right now, we've been in the midst of some of the biggest crises of our lifetimes, a public health crisis of COVID, and a longer-range rethinking of how we deal with some of the biggest problems in society, from homelessness to substance abuse to criminal justice, and how to do that in a smarter, new way. Dr. Dalal is in charge of doing both of that on a day-to-day basis as Community Service Administrator for the City of New Haven. Dr. Dalal, thank you so much for coming on the air today.
It's a pleasure to be here. Thanks for having me, Paul.
All right, you're on a delay there on the video, so we'll see how we do relating that way. But so Dr. Dalal, I'm just going to tell people quickly what he does. Community Service Administrator is a misleading title. It's really a deputy mayor position. A mayor in New Haven has 3 deputies who are in charge of roughly 1/3 of the government each. And Dr. Dalal's in charge of the social problem-solving part of society, the health department, prison re-entry, homelessness. And as part of that, he's been in charge of 2 big day-to-day tasks that have faced government in the last year. One of them is figuring out a new way in the wake of the George Floyd protests and overdoses on the green for how to rethink in a smart way how government deals with the root of problems like homelessness, prison reentry, criminal justice relating to 911 calls and substance abuse. And last night, or today if you're listening live, it's Tuesday, last night, Dr. Dalal got the second to last approval he needed from a Board of Alders committee to create a new party in city government. It's called the Department of Community Resilience, and it's going to bring together all these different experiments he and his staff have been hatching for the last year for how to think in a new, unified, creative way, how to deal with those problems. And we're going to deal with that in the second half of this program. First half, we're going to talk about COVID, because that's been the pandemic, the public health crisis of the century. Since Dr. Dalal and the Ellick administration took office, that's been front and center 24/7 challenge. I think most people believe they've done a pretty good job, but nobody knows exactly what to do day to day. And so we're going to talk a little bit about what's going on with that, because that's also been in the news. And Dr. Dalal had quite the background for that. He was the chronic disease director at the Connecticut Department of Health. He was the medical director of quality improvement from the New York City Department of Health and Mental Hygiene. And he's been on national groups. He's testified before Congress on roles like the National Association of Chronic Disease Directors and the Connecticut State Health Improvement Advisory Council. So I gave the little thumbnail, Dr. Dalal. But the other day, you guys made a decision. You were the first ones in Connecticut to declare for a city that there'd be a new mask mandate. The governor said you can go back to making your own rules. We're not going to be Texas anymore. Cities can decide whether to have mask mandates. Why did you folks decide the other day that New Haven should require masks to be worn indoors in public settings?
Yeah, thanks for the question. And I really have to give appreciation to our governor, who's allowing cities this flexibility and localities depending on their circumstances and the level of spread. So here's the bottom line. Masks work. They work to reduce spread. And we were seeing increased spread, especially in the context of that Delta variant in New Haven. In fact, right before we announced that we were intending to pursue the mask mandate late last week, the CDC categorized New Haven County as a high transmission county. And, ideally would have liked to get the mask mandate in place before we became a high transmission county, but we are a high transmission county.
And you weren't allowed to do that because, like Texas, until last week in Connecticut, local cities could not make those rules. But I'm not going to drag you into that. Instead, I want to take you back a little bit. So not only we were the first to have a new mask mandate, we may have been the last to reopen city government offices to the public at large and to drop. We never dropped the mask mandate in city buildings. I've been so interested in that because when everybody else was dropping it, the federal government was telling us we've seen the worst of the pandemic. We had the July 4th reopening. And in New Haven, we weren't as sure that we had seen the worst yet, which of course now looks prescient. The mayor had said that one reason he acted last was because Dr. Dalal, that's you, had been looking at the numbers. And when everybody was saying the worst is over, if I understand this correctly, and correct me, when you looked at the numbers, you said the numbers didn't prove that the worst was over, that people were jumping to conclusions. Do I have that right?
I think in broad strokes, yes. I mean, I think I would characterize it as a collective decision, not.
Oh, right. I mean, you're right. I mean, Maritza Bond is the director of health, and she is deeply schooled in this stuff. And, you two are a tag team on this COVID stuff and lead paint and other issues. But is that right that when you were looking at specific data, you said people were drawing the wrong conclusion by rushing to say the worst is over?
Yeah, I would say that I think there was some prematurity in terms of declaring success over the pandemic. We were all so optimistic and hopeful that at the end of the summer, of the advent of the vaccine, as numbers declined over the course of the spring and summer, I think there was a lot of optimism. And, in some part, I shared that optimism, but I also shared quite a bit of concern, and that's what I advised the mayor on. And my concern didn't stem necessarily from local data. I think New Haven followed those trends. We were going down. We were headed in the right direction. But, to answer your question of why I felt that we weren't out of the woods yet, and I think those are probably the terms that I used, were that, one, I was looking at international data. And, it just so happens I have a closer connection to India because of my sort of ethnic background. And I was hearing direct stories of people dying in India.
What kind of direct stories? Were these friends, people you knew?
Relatives.
Really? I mean, you had a relative die in India?
Not me directly, but my wife did.
I'm sorry to hear that.
Yeah. So appreciate that. And so we were getting those stories directly and understanding what was going on there. And what is now known as the Delta variant was first identified in India. I think that gives you a little background and a sense that this is a global issue, not a local issue. Mm-hmm. So the fact that the pandemic is raging anywhere, whether it be it in Florida or whether it be it in another part of the world, poses a direct line of danger to us here in New Haven.
Was there any study you saw? Like, did you look at any numbers the Centers for Disease Control was using and saying the worst is behind us? And was there a set of data that you looked at differently? Because I'm a little interested in here about data, how we interpret it, what we mean when we say we follow data. Was there a particular data? So you've talked about personal stories and an overall outlook that says pandemics aren't just local. In fact, they're primarily global in this case. So that's going to hit us at some point, depending on policies, right? If we had kept out everybody in the whole world, if we could, I don't know if we could, maybe we wouldn't have gotten here. And if everyone had gotten vaccinated. Was there a set of numbers that you saw that you interpreted differently from the way the federal government was interpreting them?
Yeah, I without knowing the specific, I think the ethos from the federal government was that we're on the right track. I don't recall hearing, at least from the CDC, that saying that the pandemic is over. So I don't recall hearing that messaging from the CDC, which is probably the government agency I listen most closely to.
But the advice was that we didn't have to stop at the masks, and you felt we weren't there yet. I had the understanding there was a data set on which they based the idea we can stop at the masks, we can open up more, and that you said it's not conclusive enough yet because of these other trends. Am I wrong about that?
I don't recall saying that specifically in response to when the CDC came out with the unmasking. I think I was following what they were saying and understood the rationale behind their recommendation. And I correct if I'm wrong, Paul, if you point to something specific, but I don't think I kind of.
No, but we kept the mask mandate in city buildings.
Oh, I see. Yeah.
We decided you felt it wasn't ready. You did not give advice that we should drop our masks.
Understood.
And you did not want to open as soon as some other people did. You had a reason for that.
Yeah, so our reason behind that was looking at a couple things. One, we identified Delta as a potential problem a few months ago. And the reason, to answer your question about a data set, we were looking at information coming out of the United Kingdom as to what the curve looked like in the context of data. United Kingdom was about 2 or 3 months ahead of us with respect to their contending with Delta. So we thought employing the precautionary principle there informed our decision with respect to City Hall. But honestly, with respect to City Hall and in including the mask mandates, is that we were mainly interested in protecting our employees and those who are coming into City Hall and making them have a level of comfort. We know we didn't have as much vaccination as we'd like. We were not doing checks at the door as to who's vaccinated and who's not. So we weren't asking for a negative COVID test. We wanted folks who needed to access City Hall services to be able to access City Hall services. And, it came down to a local decision about, how we felt we would keep the public and our employees safe.
We're talking Dr. Dalal, who's at the front lines, quarterbacking New Haven's response to the worst public health pandemic in a century, and an historic rethinking of how we deal with social problems like addiction, homelessness, prison reentry, and policing. The reason I push you so hard on those questions, because I've been very interested in the phrase following the science. Even before the pandemic, people got fond of saying, I'm data-driven, and they would have opposite conclusions to support what they're doing, and they're saying, I'm right because of data, and they cherry-pick a study, right? And not that it's bad to follow data, we should have substance for what we think, but it kind of became a meme. I feel like in the last few months, people who completely disagree with each other in the public sphere about what we should do about COVID all claim they're following the science. Right? The Wall Street Journal is a guy, Dr. Malarkey. I call him Dr. Malarkey. I think it's Dr. Markey. But it's very influential stories that are interesting. He's a scientist, John Hopkins, saying that you guys are all wrong about everything, the CDC. He hasn't corrected himself because he said we would have herd immunity by April because he was counting people who have been exposed to the virus. But he's still, like, as recently this week, he was attacking the mask mandates for kids, saying the real issue is vaccination and the mask can do more harm. Have you drawn any conclusions, given that you already were a data-driven, following the science professional, right? That's why you were chosen for this job in part. Have you had any new thoughts watching what's happening now to the way we use data, the way we follow the science, what it means, and when it's right and when it's wrong?
Oh, I have lots of thoughts on that. And so I think there's an important piece about when people say they're following the science or the data, is that data and scientific findings live within a broader context. You can't just go with one set of studies or one data point and draw a broad conclusion. This is a foundational principle of science, is consensus building. So my observation is what I often find when whether it's scientists or amateur scientists get out in front and have a very strong opinion about a specific issue, I would ask them, like, what does the broader consensus say about what you're claiming? It is part and parcel of the scientific process, peer review, and expert interpretation of data.
So that's a great approach. You and the rest of the world had to make decisions, we all in our old lives, with incomplete data sets before there was consensus, right? We had to make our best guess. And I think, if I'm not wrong, that part of your idea was sometimes wait until we get some consensus before we rush either way, especially in lifting restrictions. I could be wrong, so correct me if I'm wrong. But what about Provincetown? This is such a good example, right, of what you're talking about. So there was this party in Provincetown, a Bacchanalia weekend, really, let's be honest. Tons of people pressed close together, indoors, maybe even some mouth-to-mouth activity, more extreme, and they were vaccinated. And some went to the hospitals. This caused the entire CDC and the whole federal government to say, we have an emergency. Everything we thought might be wrong. Delta variant might be much more contagious. Even if you're vaccinated, you're at much more risk than we thought of spreading it and getting it. And that drove decisions. Then there became this counter argument that really went from both right and left. This is one case we can't say Trumpies versus liberals, right? You have de Blasio and you have Dr. Malarkey, and everybody's saying, wait a second, this kind of proved that vaccines worked, because you had 1,000 people get sick, but only 7 went to the hospital, only 4 had been vaccinated, and at least 2 of them had pre-existing conditions. So here you had an experiment where you had the most dangerous situation you could put someone in to get COVID, pretty much, that we can imagine. And almost nobody got it. What was your conclusion from Provincetown, and what's your conclusion about what it says you talked a minute ago about how we draw scientific conclusions?
Yeah, absolutely. That's a great question. So I think I would fall in the camp of the later explanation. The lesson to draw from the Provincetown situation is that you had extremely sort of good coverage in terms of vaccination, and very, very few people got sick, even though hundreds got it. That's a demonstration of the effectiveness of the vaccine against COVID. And I don't recall what percentage was Delta, but assuming a high enough percentage that CDC could draw the conclusion. So it's effective against Delta, if it's effective against the original strain, if it's effective against many strains. So the lesson I draw from that is vaccines have worked.
And then tell me if I'm getting this wrong, because I started doom scrolling. I was on vacation and thinking, oh my God, what does this mean for, I felt great about it. Like I was a shut-in for a year. I took all the advice. And then once I got the vaccine, I'm saying I'm free. The part that got me in those first few days after Provincetown, it was suggested in some media articles that this shows that even if you're vaccinated, you are just as likely to be able to get it and spread it. And that's very important to me because I see vaccination as about, I don't want to put other people at risk. My grandson, people I work with, people I meet. But it seems to me that was way off, that there is not evidence. There's evidence that you could get it, and a tiny bunch of cases get sick and tiny cases spread it. But am I correct that it turns out it's not true, that if you're vaccinated, you're still just as likely or near as likely or anywhere near as likely to get it and spread it as someone who's vaccinated?
So take that in two pieces. To get it, it's much less likely, right? So if you're vaccinated, you're still less likely to get the Delta variant if you're exposed. If you happen to get it, you are, and the data is still out on this. We don't have consensus, and as you said, we don't have time to wait for consensus. But what the CDC's latest data is saying, if you happen to get it, you may be just as likely to spread it, which explains why they
just as likely. And is that because the vaccines work once it gets into your respiratory system, but not in the upper mouth and nose?
Yeah, I don't want to get into the technical part of it too much, but it has to deal with the fact that there's a specific viral load, which is the amount of virus.
And Delta has 10 times the load, right?
Yeah, and the amount that you're shedding out. And it may be more likely to be shed out because it lives in the upper respiratory versus the lower. Again, I think the science is still developing on this.
Okay, I want to ask you a few more COVID questions till we move on, if you don't mind. So again, I'm the layman, right? So I'm trying to figure out how you guys make these decisions, and I have that dangerous tendency to read a lot about it, then think I might know something even when I get more confused. So I'm looking the other day. There are a lot of big decisions coming up with schools, as you know. So I'm seeing this decision in New Haven where bus drivers do not need to be vaccinated, but students on the bus need to wear masks. So from my ignorant layman's perspective, I'm saying that seems absolutely, completely backwards. The much bigger threat is that a bus driver who's not vaccinated can get kids sick whether or not they're wearing a mask, not kids who have a much smaller percentage of being sick can somehow get the bus driver sick. Now, what am I missing there?
Yeah, I mean, I think we've done a pretty deep dive exploration into vaccine mandates for employees. Now, I can't speak to the specifics of the relationship between the Board of Ed and their contracted bus drivers and what they can require or not, but I can speak to what we're thinking about in City Hall, which is we have ongoing active discussions on a vaccine mandate for city staff, and we have to kind of cross the T's, dot the I's, make sure we have things lined up. But we should be coming out with something soon on that.
Sounds to me like you're saying there's going to be one.
We anticipate if we can get everything in order.
That's what a reporter does. You do public health, I do reporting. I ask the question 3 times until I get you on the record, but it says like you're not quite ready. You anticipate. So one thing you said at press conference, not you, but somebody else, was that there are HIPAA concerns, meaning the federal laws against revealing people's health records. Again, my understanding, being an ignorant layman reading stuff, is that was total hogwash, that only Marjorie Taylor Greene still believes that HIPAA can be invoked to stop a vaccine mandate, that you're totally fine to ask records of city and government employees, as they're doing in New York, about whether they're vaccinated or the Army. Am I wrong, or was I missing something there? What was that HIPAA thing all about?
So I didn't follow the story too closely, but I think what's important to remember about HIPAA is that it applies to specific entities. So it doesn't apply to individuals being asked questions by the media. So you don't. I'm
not talking about media. I'm talking about if government wants to have a vaccine mandate, you're allowed to know whether an employee has or has not gotten the vaccine, correct?
That's my understanding, but there's privacy concerns around accessing health record data, so that just has to be navigated. So
for media, but what about the employer? There's privacy.
Right. That's what I was responding to. There's still privacy concerns about the direct access of data that has to be navigated. But to my understanding, and I'm not a lawyer, is that employers are allowed to ask vaccination status.
So this is where, again, I'm the ignorant guy just watching. I mean, the Army's doing this. The New York City's doing this. Even red states, some of them are doing this. Why are we still hung up on this question? Are we just being more careful? Do we have specific labor agreements that are just out of the 1920s? I mean, what's the...
Yeah, no, I think we're going to get around these issues. We just got to make sure we're right. We don't want to do it wrong and then have it not work out.
Would that be a more general statement too? We don't want to do it wrong. Have you been a little more cautious, especially in terms of opening up to make sure you don't get it wrong? That's going to be our segue to the community resilience.
Yeah, I mean, the precautionary principle applies to a lot of things. I think we traditionally think of it applying to public health, that you don't want to, you want to be extra cautious in the face of uncertainty. So, it does apply, not in every case, but...
you want to be extra cautious in the face of uncertainty.
Yeah.
Does that mean it works two ways, right? If you're not sure how dangerous something is that can kill people, maybe cautious means have that mask mandate earlier because you just want to be double sure. But if it has to do, if you're not sure if lifting a mandate will endanger people, that means you go more slowly in lifting it. Is that a good way to put it?
Yeah, that's a fair way to put it.
All right. Karen Dross is listening. Hi, Karen. She posts, I am a home visitor starting in September. Good luck on that job. I'm expected to go back into homes for 90 minutes once a week. I have concerns. Schools are sanitized by staff. We can't control how families sanitize. Thanks for that question. That's a good question. Dr. Dalal, a year ago, everyone was buying hand sanitizer. You couldn't get it. Am I right that while it's always good to wash your hands, just to keep flu or anything away, we don't know of a single human being on earth who was protected from getting COVID, if we want to look at data, because of hand sanitizer, and that sanitizing is important, but it really has nothing to do with whether people will get COVID as far as we know. Am I correct about that?
It's a very, very low risk. I don't know the latest on whether there's any, it's hard to speak in absolutes given the pandemic has infected millions worldwide. I'm sure, you could identify a case where, contact would be the most likely mechanism. But in terms of emphasis, and I think, one of the things that we should do a better job as in terms of messaging is that what are the things that are the most important? And it turns out, this is where the science evolved. Like they used old models to emphasize the sanitizing approach. I think it's still important. I think it still should be done. There's still a risk with respect to contact related transmission. That's the protocols that those should be followed.
But there's a risk about anything in the world, right?
Yeah.
I have a much greater risk riding my bike on Whaley Avenue. I have to make sure not to go by the boulevard by Blake Street. Seriously, there's a turn there that the driver just never sees you.
Yeah.
I guess my two concerns about the hand sanitizer is I understood why people did it a year ago because we didn't know. And as you say, there's a history in science of germs being transmitted through contact. But once we learn that it's almost all through breathing, I wonder whether there was a problem that even today, when restaurants, bars, offices talk about the precautions they're taking, they emphasize this hand sanitizer thing. And especially since a lot of it's antibacterial soap, which again, I'm a layman, to my understanding, makes the world a much more dangerous place the more we use antibacterial soap because it helps create superbugs by responding to antibacterial. Am I wrong about that or way out of my...
Yeah, I'm not aware. I'm not. So the antibacterial concern about superbugs relates to overuse of antibiotics, not
antibacterial soap.
Yeah.
So antibacterial soap's okay?
Yeah, as far as I know, again, it's not something I've looked up in the recent past, but the concern is among antibiotics where the bugs can develop resistance. So I don't think there's anything wrong with emphasizing hand sanitation. It's a good practice overall. It's a good hygiene practice overall. But to speak to the listener's question, I think in her case, I think the vaccine will be the best protection. Masking will be the next in priority. And if the weather allows and the client allows, having some ventilation with open windows will be the next.
That's actually a big school problem too, because the schools had terrible ventilation in some cases, like all those clogged filters that had never been changed and the HVAC systems that broke down, right?
Yeah, so I think ventilation is rose in prominence in terms of what.
So your advice to Karen is crack a window if you can. Make sure you're vaccinating. Hope the person she's going to is probably vaccinated because they're elderly. Might want to check. Should we tell her not to worry so much about the sanitation, except for general reasons that we should always be, but not worry about dying from COVID from that?
Yeah, I think she should, and on her own end, take as many precautions as possible. Follow the hand sanitizing, wear gloves where possible, and whatever practices that her agency has in place for sanitization. But I think the being vaccinated, wearing a mask, getting good ventilation is going to be really important in our case.
I'm so interested in hearing you speak as a doctor trained in dealing with data and policy, now applying that as the city's community service administrator to these two big challenges. Is there something you've learned in the past year dealing with this pandemic that's changed your mind? Taught you something you didn't know, it changed your mind about how to do the job you do?
Yeah, well, everything's changed.
I didn't know it at all when it started.
I didn't sign up for this job knowing that there'll be a pandemic coming. I just got.
Would you have? If you knew, would you have?
Oh, in a heartbeat. I trained. You referred to. I did train as a doctor. I did clinical medicine for a few years, but then I just went into public health. So I consider myself a public health physician. So that would, I would say that would be something that I'd jump on board for that challenge. Not that we want to do that, but it would be an opportunity.
That's why you go into this work, to save lives and try to make an impact on a larger scale. Correct.
Exactly.
So what have you? Tell me something you've learned in the last year that's changed your mind or built up some of what you didn't know.
Yeah. So here's what I'm going to say. I'm going to say that when it is much easier to get things done than people sometimes believe.
Really?
Yeah.
That's a nice thing to hear from someone in government.
Yeah. Well, yeah, I've spent a long time in government, and
We're sending you to Yale next and see you still think that.
I think a lot of times, what I personally learned is that sometimes you can overthink things a lot, right? Especially in the face of uncertainty, and not just me personally, staff, partners saying what's the right decision, what's the right thing to do. But I think getting heads together, deciding on a plan, and moving forward on it is sometimes the best way to learn in terms of whether we're doing the right thing or not, and whether it'll work or not. So I think probably the lesson I've learned in terms of responding to the pandemic, responding to the other crises that you've referenced, is that let's get in the game and try to do something rather than trying to overthink it.
That's what I love about interviewing people who work for city government, is that there's a cynicism about government that I think started in a big way since the Reagan era, that they're the problem instead of fixing problems. And anytime I or another reporter goes around with the sweep team, your inspectors who go try to make things better in neighborhoods, or inspectors, or people really sweating it out trying to come up with policy to save people's lives, it's very inspiring, because you do come away, if you're closer up to it, with the idea that as a society we can tackle problems, and that the answer is yes we can, and it's we, rather than no we can't and it's they. Yeah. Sounds like you've kind of come away with some of that same feeling.
Yeah, absolutely. Yeah.
Did your family do okay with COVID? Your immediate family? You said your wife's family had a death in India. How you doing in New Haven? You were working hard.
Yeah, we did fine. Thanks for asking.
Kids too?
Mm-hmm.
Were you ever worried? Like, I'm going to these meetings, I'm kind of pushing against the boundaries of some of my own policies because I have to deal with an emergency as a public official. Anything special you had to do? Anything you worried at night about having, because you have kids, right? And you're married. Anything you did special to protect against that, or any thoughts you had on that?
I think we just kind of constantly updated what our risk tolerance was around this, and I think we were pretty good about making sure we were practicing the best protection that we could. That's masks, distancing, and I think it's always in the back of people's mind, my mind, and making sure that we exhibited the right risk, and making the right calculation around risks, and I think that's how we handled it, and that's how everyone.
And in my shul, my synagogue, heard the most inspiring take on mass this weekend from our rabbi, because we all came back. A few of us went all year, but most of us didn't go in the building. Then we came back a few months ago after vaccines, and we're going to try to hang in this time. It seems like it's not an exact replay of last year, that the things you could do if you're vaccinated to keep it safe, but we're putting masks back on. And he said, we're also disappointed. It invokes trauma of what happened last year, like it's all over again. But another way of looking at it is that you don't have a repeat. It's never an exact repeat. When the virus comes back, we know a lot of things we didn't know before, and we have protections we didn't have. And that masks can inspire us too, that we're saying even though we don't want to wear masks, it's a reminder that we care about each other and we want to make each other safe, and we're part of one community, as opposed to being off on our own without caring about each other, without any tools to do it. So I kind of found that exciting. Where do you think we're headed next with the virus, the pandemic? Will it be like last year, where we're all locked in for months at a time? Do you think we're going to have waves of it, but we're gradually on the downside? What's in your crystal ball?
Yeah, so I hate to make predictions that are not going to be true. Here's what I hope. I hope that the trajectory of Delta, and there's no guarantee this will be the case, but what we've seen in the trajectory of Delta in the UK is that it's spiked up quickly, but then it also is falling quickly. So that's my optimistic scenario, that we'll see that type of trend. Like, I know we're still on the upswing here, so we got to hang in there for a little while. I'm optimistic or I'm hopeful that that's the same trend we'll see.
Am I right that a lot of us who followed good advice to shelter in place last year aren't going to need to do that again? We're going to be able to go shopping. We're going to be able to eat outdoors, be able to go to our synagogues. There's a lot of rules, go to our jobs, but just it's a little bit different this time if we're vaccinated.
Yeah, it's not going to, I don't anticipate, and I don't foresee that it's going to be a repeat of what happened last year. We have pretty good vaccine coverage, right? For all, so many people, majority are protected. Those who aren't yet protected are under 12 or have certain immunocompromising situations where the vaccine is either not indicated or ineffective, or they have an allergy to the vaccine. I would be very surprised if we had a situation like we did in the early part of the pandemic, where we had, much fewer tools. I mean, we have the tool to get us out of this pandemic, which is the vaccine. The one curveball that I'd be afraid of is a new variant coming up,
which is going to happen, right? There'll be other variants. Am I right, again, as the amateur, when I'm reading, my understanding is that all, like colds have continual variants, flu, that at some point it stops being like Delta, where every new variant is scarier, where also these coronaviruses have their own lifespans, where the variants become less threatening over time, and then we kind of live with it long term. Is that not true?
That's definitely a possible outcome of this, is that there's multiple variants that we get good protection for, and it's another disease that we'll have to live with, like we live with the flu.
Dr. Dalal is helping us live with the coronavirus. He's the Community Services Administrator, meaning Deputy Mayor for Social Problem Solving at the City of New Haven. You're listening to him on WNHH's Dateline New Haven, 103.5 FM, live streamed at newhavenindependent.org. You talked about sometimes going a little more slowly to make sure you get it right when things are on the big things are at stake. And that leads us to really the second big set of problems you've been taking on last year. When you took office with the rest of the administration's picks, you didn't know there was going to be this public health crisis, and you didn't know that George Floyd was going to die when he couldn't breathe, when the police officer kept his knee on his neck, and that the nation would explode in protests about how we police. A year later, you have come up with a whole set of proposals you've been working on. You didn't rush them into place, but now they're getting their approvals, including an important one last night from a committee of Board of Alders. You have a set of proposals for dealing with homelessness, prison reentry, substance abuse, policing, 911 emergency calls, and you're calling it community resiliency. You're creating a new city department to put a bunch of these proposals under one roof. Do you want to briefly tell our listeners what the Department of Community Resilience will be, assuming it gets approved, and how it's taking a new approach?
Absolutely. Thanks for the opportunity. And, just to give some context, when I stepped in this role, and when I started to get to know my team, some of them had already been working on these issues. Like, we had been working for reentry programs for a number of years. We've had a homelessness outreach and programs for a number of years, and some of this work was already going on, and they had a long kind of arm of experience on. And
it was before you came in office too, and we had the massive. They turned out not to be overdoses, but drug poisonings with KT2 on the green, and figuring about how do we also think of a new way with substance abuse. Yeah,
and I say that to say that, going back to the conversation about government, is that when we encounter different problems or different demands from constituents about the definition of social problems, what they want from us, it's incumbent on us to think differently about how we provide those services and interact with the citizenry.
And it is interesting to have a job like yours when you're handed a job at a moment when society is saying, do something big, new, fix it. It's a challenge, but it's also kind of cool, right? If you're in the job because you want to do things better. So one thing you did was you used the pandemic to think of a new way of housing people homeless, if I'm not mistaken. Right. Instead of holding them in shelters where they get COVID, you put some in motels, but you also kind of got more people, like over 100, I believe, into supportive housing, which means longer term housing where maybe the problems aren't fixed yet, like substance abuse or poverty-related problems. They get services on site, but it's a long-term apartment. It's not a shelter. They can start rebuilding their lives with the help for training or healthcare or mental health or job training. How did you do that? How did you suddenly get a lot more people in supportive housing, and what does this mean long-term?
Yeah, I'll just do the friendly amendment. They didn't all go to supportive housing. Supportive housing is kind of a term of art in the homelessness community where it is exactly
right, like Liberty Community Services, right?
Yeah, so we actually housed over 600, and many of them went into deeply affordable units based on the fact that they had some income from SSI. So
that's Social Security.
Yeah. I know you asked a number of questions, so I'm going back to your earlier question about the Department of Community Resilience, just to give listeners a flavor of what that means. So the work had been going on before. The Department of Community Resilience is really a way to establish a focus of leadership and coordination in city government that handles a set of interrelated issues. So housing is one piece of this, and you had referenced getting folks into homes. So Housing First is a big movement in the homelessness services world that we want to make sure that folks have a stable housing in the course of addressing many other issues that may have. So this new department would encompass that philosophy, but it also encompasses the fact that there are many, many other supports and related set of problems that go along with homelessness, with substance use, with mental health issues, with violence, either being a victim of violence and trauma or being a perpetrator. These sets of issues are so interrelated, and in the past and up to now, we've dealt with them kind of ad hoc and individually. There's many, many great agencies that do work with individuals and can provide the services they provide. But what's been lacking is an overall leadership and coordination structure. So that's essentially, in a nutshell, what this department would provide, is having a named person who's a department head. And as you know, department heads carry substantial authority in the city.
So that can be Carlos Sosa Lombardo?
I am not. Carlos is the director of special projects.
Yeah.
So the department head is going to be a newly established position.
Okay, and then some of the ideas, and tell me if I'm saying it wrong. As you said, projects in the work for years. You use this opportunity because there's a lot of federal money coming in to help make this stuff happen. Prison reentry, you reopened a reentry center at Project More for people coming out of prison so they don't go back right away. They get the help they need. And the crisis response team, we're trying to do something Eugene, Oregon has done, the CAHOOTS program, some other places in the country, where up to 10% of 911 calls that might not be best handled by cops will be handled by teams of social workers, medical professionals, substance abuse counselors, other people, mediators who can help maybe solve a problem and get people help rather than have being arrest. Yeah. One thing, I was so surprised to see that 10% number because there's 100,000 calls a year to 911 or more. So while that's a lot of calls, it's also not a lot of calls. That means that 90,000 or more calls will continue to be handled by police. So this isn't defund the police at all, right? This is about supplement and get the right kind of help for emergency calls that might not be best handled by the police, correct?
Yeah, absolutely. This is not on the banner of defund the police. This is about, really, it's just something that the police department wants. That's
what I was going to ask you. During Black Lives Matter, I didn't say this on radio because I was told I'd get crap beat out of me. I probably would have at the time. When Black Lives Matter started, there was a really important racial issue that all sides did disagree on, about whether disproportionate treatment of, and I was on the side that said people of color are disproportionately treated wrong by policing. But in terms of what to do about it, I felt there was a grand bargain that was being overlooked, which was that when community policing started in New Haven in the 90s, what I continued to hear for decades from cops who didn't like it, the more conservative cops, we might call them today the Trump cops, they say, we're not social workers. Why are you making us be social workers? And we said, well, you're training with your child study. You got to figure out how to solve problems. They said, we're not social workers. Social workers do that. Leave us the job of arresting people. The protesters were saying, you're not social workers. A lot of these problems, like people with mental health problems, drug problems, really are best solved by social workers. So I kind of felt I was hearing from the two sides that were yelling at each other and dehumanizing each other an incredibly fundamental agreement that could be the basis of a policy that moved it forward. Is that a naive way of looking at it, or is that in fact what's underlying the crisis response team?
No, I think that explains why there's broad support for it. There's broad support, from Chief Reyes when we first started, now Chief Dominguez and her leadership staff. and there's broad support among social service providers who understand the potential victimization of unwarranted law enforcement contact that communities of color have suffered for many, many, many years.
So how do we get to that? So assuming that people on all sides, even if they disagree about race, can agree with so many of the nuts and bolts incidents that occur on the ground and how to fix them. It's still hard, and we're doing it, and hats off to you for doing it with this team. I hope it's a great success. How do we get to the other fundamental issue about race and policing? In the last 6 months, every cop of color has left the top ranks of the police department. For the first time since the early 90s, we now have a police department with not a single black or Hispanic chief, assistant chief, captain, and only one Latino district manager. No one's talking about this year. If this had happened last year, I think it would have been huge protests to shut down the police department. How do we deal with that in your roundhouse? Is that issue still alive, that we need people of color helping to deal with people of color and being represented in decision making and criminal justice and problems? Or is that aspect just for another day?
Well, I think it's a big issue, and again, it's kind of out of my domain to
right. You don't oversee the police department. That's chief administrative officer.
Yeah. So, but I think exactly what you mentioned, having a diverse representation in leadership and decision making. Again, I don't oversee the police department, but I think that's something that we're really thinking closely about in terms of crisis response, making sure we have diverse voices represented and in meaningful, not in like kind of window dressing roles, like in meaningful roles. And I've been reminded about this, and I appreciate when community members and alders remind me that, if you're going to have and plan something like a crisis response, is that you have to have meaningful engagement from the community, and it matters what kind of decision-making structure you set.
And pretty much every person you've pointed to some of these key roles is a person of color, the prison reentry, Carlos at the project management. So, okay, so I guess you definitely answered that question. One of the most inspiring but least noticed developments I've seen on this front of rethinking how we tackle these problems as a community, I know you were involved in this. It was like a 2-day story in The Independent. I didn't see covered anywhere else. In the Hill, neighbors have been very upset about how drug crimes are affecting kids. So there are an extraordinary concentration of social services and health services for people with addiction in the Hill. Yeah. Grant Street, Hill Health, which is related, they're expanding. And you go to the John C. Daniels Playground, there are needles everywhere, right? And there's a lot of behavior on the streets from the App Foundation. Whole another story. We'll talk about that another day, about policy with that. And what was so interesting to me was the community management team there didn't say, let's stop everything from happening. Let's stop giving people care. They said, let's get together with you, the police, the people who run Hill Health, and figure out a humane way so that the people who need help, and kids and families aren't dealing with the results of out-of-control quality of life behavior. And you had a day-long Zoom, or an afternoon-long Zoom conference about how you're going to rethink that. What came out of that?
So I think, I share your kind of conclusion from that meeting. I think I was really, kind of.
I was blown away.
Not necessarily surprised. I think I was pleased to hear that was the sentiment. Because
otherwise it's always either you're NIMBY, don't help anyone, not in my neighborhood, or bring it all in and everything's out of control. They're saying let's do this in a smart, humane way that helps everybody, which is hard.
Yeah, and I think it comes to the realization, I've said this before, I don't want it to become cliche, but you can't arrest your way out of this. There isn't a way to do that. If you bring down the long arm of the law on this, you might be able to put people away on something for a couple of days, but it's not a long-term solution to the problem. So I appreciate that folks have reached that conclusion and are willing to work with the social service side of things in a longer term plan to address these issues.
So they talk about some specifics, give out a lot more information to people if they'll get the help. As any of us who have dealt with people with long-term substance abuse or mental health challenges know, people aren't always ready to get the help. Mm-hmm. And I've actually concluded it's really darn hard to help people who aren't ready to get the help. But sometimes when they are, you got to be there with the help. So that was one of their ideas. Another idea was drug market intervention. What any good initial ideas come out of it that you've heard?
Yeah, so the one thing that we are doing is that I know there's some discussion about in terms of the syringe litter as to where an optimal placement of a safe syringe disposal site would be.
That's actually, that could be very effective.
Yeah.
It's like when we gave out free needles first in New Haven to test it for the country. It did save lives. Now we got to talk about disposal of needles. That's really interesting.
Yeah. That's really part and parcel of needle exchange, is to ensure that folks have an appropriate way to dispose of needles. Or you get a situation like you do, and I think John C. Daniels is a prominent and unfortunate example. But there are other sites in the city that commonly see needle litter and this syringe litter. So what we propose to do is put in syringe disposal kiosks. Where
that's right, and you had Gar Waterman design him. He's one of my favorite artists. I love that guy. Okay. Yeah. I saw that one in Fairhaven too. Yeah.
And although I think we got pretty strong feedback that they didn't want the disposal, right near the playground where
right.
We are working on finding an alternate location that's close enough. It's worked in other cities. Some people have the sentiment that, well, if they're using the drugs, they're in no state to actually dispose of them properly. But I think with some engagement and education, that's one of those kind of small step things that I think.
Right, because a person dealing with crisis isn't always able to focus, but in fact, they're human beings, and you can appeal to people. You don't want to hurt a kid. There's the kind of thing that you talk about what inspires you is problem solving. I can't think of anything I enjoy more than that nuts and bolts on the ground way of solving problems as a community, like thinking, where are we going to dispose needles as a way, but then where to put it, as you mentioned, as we wrote, there were people who didn't want it on a certain block, but then said, so where's the right block? That's like God's work. It's kind of fun in the details. What do you think about
what cities? Definitely in the weeds. Yes, it's definitely in the weeds.
What do you think about cities like Ithaca that have had areas where people can shoot up legally and safely, and there's social services nearby in case they want it? That's a very hot topic, very controversial. Would you like to see one of those safe injection sites here?
It is very controversial, but at the same time, at least 12 other countries have sanctioned, safe injection sites or overdose prevention centers, and Philadelphia.
Would you like a safe injection site here? Should we have one?
We're looking at the literature. I think it would be a potential next step in terms of harm reduction. My understanding is that it's an effect. If our goal is to prevent overdose deaths and protect those who are, happen to be in addiction at all levels, and it's not like this or like you're either in treatment or we're forgetting about you. It's a compelling intervention when you look at the international data. But
right now you got like 5 other major game-changing plans to try to roll out in the next year or two.
There's not a single death that has been reported in over 120 sites in these.
Wow, that's really interesting. So last night, when you got unanimous approval from the Board of Alders, so you're on the way with this new community resilience program, the one question you got over and over was, why do we need this new? You have the Community Services Administration, that's what you oversee, that already has all these departments. Why did we need a new department when we could have just said, continue to have it all under your roof and just have them collaborate more?
Well, they would still be under the CSA roof. It's a matter of organizing it. It's a matter of giving them the level of authority and stature that another department has. The Youth and Recreation Department has a certain mission, has a certain vision, and it can carry out that vision under leadership because that's what they're supposed to do, and that's what have been given the authority by virtue of being a department of saying that this is your job, and it's your job to execute on these programs, and it's your job to advocate for the youth. Mm-hmm. Similarly, having a Department of Community Resilience is telling the community, telling our citizens that we're making a long-term commitment as a city that we're going to address these problems, these long-term problems that we have been previously addressed in scattershot ways.
And by the way, things can't get done. We just got an alert that the U.S. Senate has just passed the bipartisan infrastructure bill. Miracles do happen every day, don't they?
I'm starting to be hopeful. I think I'm hearing a lot more miracles coming through, so that's great.
All right. Well, I want to give you time to go back and make some more miracles. I appreciate that you came on. 2 last quick questions before I let you go. Are we going to need booster shots for COVID?
I don't know the answer to that. I think they're looking at the science right now. There's going to be some populations that are definitely going to need them. And time.
They're saying Pfizer and Moderna. And boy, are we lucky that those are the ones we got rather than Sinovac, however you say that, from China. They're saying it wears off after 4 to 6 months. Or it just wears off a little, not enough to matter.
Again, I think the jury's still out.
So you're saying don't jump to conclusions. Let's take our time and do it right and look at the real data.
Yeah.
Okay, the other question I heard the other day, the mayor was at a candidate forum in Beaver Hills, and someone spoke up and said, my biggest fear about you getting reelected is that you've got some incredibly talented people working for you. Specifically mentioned you and Maritza Bond in the health department. Are they going to stay? What do you think? You plan to stick around?
I mean, look at what we're trying to create. I mean, we're committed to this, and I look forward to seeing this through.
All right, Dr. Dalal, thank you for answering my questions, including when they were asked 5 times in a row. Thanks for joining us on Dateline New Haven. Good luck on all the great work you're doing in city government.
Appreciate the opportunity. Thanks.
Hope you hit it out of the park. Thanks to Harry Droz, our station manager, who works all the controls, gets us on more platforms than exist in the arithmetic system. We're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It Would Feel to Be Free from the group's CD A Plea for Peace. This is Paul Bass inviting you to fly free with us all day and all night here at WNHH, New Haven's home for community radio.
You'd understand that I was once her man. It's got nothing to do with me and you. Then you heard her say she needs me. You have to realize we've been through this 1,000 times. My future refutes what's on my mind. We've talked about squashed. She broke my heart in two, and I hope that it would be mended by you. But what I'm getting is not what I was expecting. So why should I try?